15107 There's also the option of giving us a call. The number to dial is 015 1058 1058.
Have your say. Call us now on 015-151-1058.
Dr. Maluleke, good evening. Welcome.
Evening, Rebecca, and good evening to our listeners.
How are you, Doctor?
I'm well, and how are you?
I'm well, thank you. We'll begin our discussion by looking at what this month is understood to be in terms of the awareness drives that we often observe as we talk about different months with regards to issues of gynecology. You'd remember when we started the month, you did alert us to say for the month of May, the focus is on hysterectomy.
Yes, this is the Hysterectomy Awareness Month. Basically, trying to make people aware about the operation known as hysterectomy. You know, the processes involved, the reasons thereof, the consequences of doing an operation such as this, and perhaps to give support to people who may have had this kind of operation. And hysterectomy, it's a procedure whereby an operation is done to remove the womb. Hystero is womb, and ectomy means excision or removal. So hysterectomy means removal of the uterus, right? There are reasons, of course, why people may need to have this kind of operation. It's one of the major operations that can be done in a woman's life, knowing the importance of the uterus in terms of reproduction, in terms of menstruation, and it also has some psychological connotations because women feel they are complete when they have this uterus. Once it is removed, some of them feel they are not complete, and therefore their femininity has been adversely affected. The reasons are variant. They vary from one person to the other. The commonest ones in our people would be the presence of fibroids, which will lead to heavy menstruation, painful menstruation. These are people who suffer a lot during menstruation. And one of the possible solutions for this would be to remove the womb itself. Secondly, the womb gets removed when you've got changes on the cervix that suggest that cancer might be starting. You know, these are known as CIN lesions or squamous intraepithelial lesions, as the newest terminology is used. So we often go and remove the womb for that purpose. These are some of the commonest reasons. Occasionally, it can be done as an emergency, following the birth of a baby, when the womb has ruptured, or we are not able to maintain or stop the bleeding. So we do it as a life-saving procedure, so that if we did the hysterectomy, this person's life will be saved. It's one of the reasons why sometimes we may have to remove the womb. In the past, we used to see a lot of women coming after unsafe abortions. They've had this abortion done in a backyard. They come with sepsis. There's a lot of pus in the pelvic area. The uterus is basically rotten. And for us to save this person's life, we have to remove the source of the sepsis, which would be the uterus itself. So these are some of the reasons why we may remove the womb. Now, there is a question of whether the womb can be removed together with its attachments. The attachments here, we're talking about the fallopian tubes, we're talking about the ovaries. In general, the guideline is that if a woman is younger than 40, we can preserve the ovary because this ovary still has a number of years of function. Remember that the ovary is not just a reproductive organ. Beyond reproduction, the ovary functions in terms of maintaining the cardiovascular health of that person, the blood pressure, the heart health, and also a major function of the ovary is to maintain the bone structure integrity. This is why older women tend to have bones that are brittle and they fracture easily. Whereas if you still have the ovary, you're not likely to rupture that, to fracture that easily. So we preserve the ovary for that purpose. It also gives the woman the feminine look, the hourglass figure, the fullness of the breast, the skin tone and turgor of the skin. All these things are because the ovary is functioning well. Once the ovary stops functioning, that hourglass shape is lost. You tend to have wrinkling of the skin, the breast becomes flab, and you tend to have redistribution of body fat. The fat now moves from the hips to the abdomen and the upper part of the body, and the legs tend to thin out. So the body shape tends to be affected by the presence or the absence of estrogen, which is produced by the ovary. So the ovary is then preserved for that purpose. Nowadays, even though the general approach has been that if you're older than 40 and you get a hysterectomy done, the advice would always be that you need to remove the ovary as well. This is done partly to protect women against the development of cancer of the ovary. But now they are saying if the ovary is healthy, why remove it? Why do you have to remove it? You can as well keep it until it stops functioning spontaneously, in which case now the woman will develop the symptoms of the menopause. But there are still people who believe that if you're older than 40 and you're going to have a hysterectomy for whatever reason, the ovary should be removed as well. That means then you need to be put on hormone replacement therapy at that time.
So in instances where the removal is being made, but it doesn't mean that it poses the threat of losing life, do you then give them the chance to opt for or against?
Yes. If, like fibroids, we have always said that fibroids do not necessarily kill. And the fibroids will be a problem for the time when the woman is still menstruating, during the reproductive years. As soon as you stop menstruating, the fibroid stops growing, and the symptoms of the fibroid will also subside. Therefore, if you are older and menopause is beckoning, we would not urge you to have the womb removed, because you can actually live. I actually do have a lot of patients that have fibroids and they are menopausal and they're not having any problem. They just come for their annual checkup. So it is not a must in some instances where the condition is not life-threatening that the womb needs to be removed. Okay, if you've got precancerous lesions, the high-grade squamous intraepithelial lesion, what previously was referred to as severe dysplasia or CIN1 or CIN2 or CIN3, then there we are talking about a potential life-threatening condition. We would urge that if you are no longer reproducing, to have the womb removed.
All right. We're talking all things female health with our resident gynecologist, Dr. Maluleke. This is how you can get in touch with us if you would like to also ask a question regarding gynecology. Our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note line is 060-771-5107, 060-771-5107. We continue by beginning after the break with checking out your questions, and we'll do that after the break.
Have your say. Call us now on 015-151-1058.
So that, doctor, what is it that you remove exactly? Is it the womb or is it the uterus?
It's the same thing.
Is it the same thing? Okay.
Womb is the term used by the lay people, but the uterus is what the medical people will call it. Right. And the womb is comprised of the body, what we call the corpus, and it's also got the neck, what we call the cervix, and it's got the adnexa, which are the tubes and the ovaries. These are the attachments that we talked about. So when we talk of total hysterectomy, we are only referring to removing the womb and the cervix. Sometimes you can do what we call subtotal hysterectomy, where you leave the cervix behind. This is often in instances where the operation is done at the time of delivery of the baby, where the cervix might be friable and so on, and also that we want to do the operation quickly because the person might be unstable. So we just chop that uterus and leave the cervix behind. And that way we are able to maintain hemostasis. In other words, we are able to stop the bleeding and keep the person alive. But in general, the cervix needs to be removed because the cervix is a major source of potential cancer. And if you have had the womb removed and the cervix is behind, you still have the risk that you can develop cancer of the cervix. Right.
The most exciting part of a wedding for a bride is wearing the perfect wedding dress. Beauty of the Bride specializes in perfect wedding dresses designed for a fairy tale wedding at affordable prices. Come check out the new Beauty of the Bride bridal boutique in Polokwane and find your perfect dress. Visit shop number 13 Standard Bank Square, beautyofthebride.co.za, or call 072-472-5181 to book a free appointment. Beauty of the Bride. It's all about the dress.
Conversations, Mondays to Thursdays, 6:30 to 8:30 p.m.
The time is 5 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. We are in the middle of our open line of female health with our gynecologist, Dr. Maluleke. He's with me in studio, and this is how you can get in touch with us if you would like to ask a question. Send us a voice note to 060-771-5107, 060-771-5107, or send a WhatsApp text message to 079-295-1212, 079-295-1212, or give us a call. The number to dial is 015-151-1058.
Have your say. Call us now on 015-151-1058.
All right, let's go to the WhatsApp text messages. Hello, Dr. and Rebecca. I've tried the plain yogurt remedy for vaginal care, and yeah, I feel good and sex is enjoyable and the smell goes away. So I want to know about this one of putting the yogurt inside of the vagina for yeast infections. What is the method to do it, doctor?
Simple. You can dip your finger in the yogurt and then put it in the vagina. You can use a teaspoon to also put the yogurt inside there. Simple.
Remember when you spoke to us about douching?
Yes.
Is douching only when one is bathing? I'm reminded
Yes.
by when you say they can use their finger.
Yes. Douching is when you're bathing. We had said that there's nothing wrong with douching.
Yeah.
The problem is what you use to douche. People buy these deodorized substances that smell very good. They call them feminine washes. And these go and disturb the environment in the vagina. But if you were to use just water, maybe with a bit of salt in the water, then by all means, that will not disturb anything. But once you use bubble baths and some of these substances that we will not mention on air, then you're causing a problem.
All right. Good evening, doctor. I recently had a miscarriage at 6 months and they told me that I have a small cervix. I want to know what is the procedure that I have to go through when I want to have a baby so that I can carry till full term, and how long should I wait to try to conceive again?
Right. The listener seems to be having a condition known as cervical incompetence, wherein the cervix fails to close so that the baby can stay inside and grow. In this instance, when you have this kind of problem, when you fall pregnant, you will need to have a stitch inserted, what we call either a Shirotka stitch or a McDonald stitch. And the procedure has to be done between 12 and 16 weeks of pregnancy. The reason for that is at the 12th week, the baby's organs are fully developed, and therefore we are able to see if this baby is a healthy-looking baby or the normal structures of the baby are there. Because it won't make any sense for us to go and put a stitch in a pregnancy where the baby has got life-threatening abnormalities or conditions that are not compatible with life. In the end, you will have a baby, but this baby is not going to survive anyway. So we wait for the 12th week so that we can do a good ultrasound to see if this baby is fully developed with all the organs being present. Now, beyond the 16th week, that pregnancy has grown such that the membrane may already be encroaching onto the cervix. Therefore, if you put the needle there with an intention to go and tie the cervix, the likelihood of you causing a rupture of the membrane would be high, and you'd still lose the baby anyway. And that is very bad because it would have been caused by the doctor, what we call iatrogenic miscarriage. So we would want to avoid that. Now, the reason why I'm mentioning this is that people who have cervical incompetence need to see their doctor as soon as possible once they realize they're pregnant, so that the timing for this stitch is not missed.
Okay. Good evening, Sis Rebecca and Doctor. I'm 25 years old. Kindly advise. Okay, we'll come back to that question. My husband says that there's something scratching his penis inside my vagina. I went to the clinic to check, but they did not find anything. What's the cause?
Well, they didn't find anything, so we don't know what the cause is. But in general, there will have to be an examination, right? We pass a speculum, or we can even do a pelvic examination. But at speculum, which is that metal thing that we put in the vagina to expose the cervix, and also look at the inside of the vagina. With that, we'll be able to see what is going on there. But it's very strange that at the clinic they found nothing. So very interesting. But, well, at the clinic, it is the nurses that did this. So maybe the next step would be to see a doctor.
So when the nurses said they don't see anything, do they not then advise that one may need to see a gynecologist?
Normally that's what they do. And that's how the health system works. If you went to a doctor and he is not able to get a solution for your problem, they need to send you to the next level. That is how it works. Even us as specialists, there are still people who are much more experienced than us, or who have done certain procedures more than some of us. So with this in mind, if I find a patient that needs the expertise of some of my colleagues, I will refer the patient there.
And on a general scale, just from the description, does it give you any idea what it would be? Just for interest's sake, in case there is somebody else who say they've heard that before. Their male partner saying there's something that scratches me whenever we have intercourse. What could it be?
One of the commonest reasons why this may be so would be the presence of the intrauterine device, the loop. Sometimes the strings were not cut that well, and therefore they may cause this sort of sensation on the male. Sometimes it could be a presence of a foreign body in the vagina, believe it or not. Some people put things there and they even forget about it. I mean, I had a patient a couple of years ago who comes to say, look, I'm having a very bad smell. I'm not sure what's going on. When I examined, I found an old tampon in there, which obviously if it stays longer there, it's a nidus for infection. Therefore, the smell could easily be explained by the presence of that old tampon. But lesions that could be in the vagina that might cause the scratching would probably be vaginal warts. But the warts, if they are inside the cavity of the vagina, the likelihood is high that they will also be there on the outside. And he would know about it, or she would know that she's got warts. So those would be some of the reasons why he may feel the way he does.
All right. Good evening, doctor. I'm not too sure what it is, but I have pain in my vagina, especially when I start getting intimate with my partner. It sounds very similar to the question we just asked now. It goes on to say, I'm not too sure if I have a scratch or I'm swollen inside. What could it be?
Yes, once again, the only way of knowing is if she went and get examined.
All right, let's proceed to other questions. Good evening. This is anonymous. What are the common tablets given to pregnant women, and amongst them, is there any that perhaps may lead to some effects such as pain in the lower abdomen? For it happens that whenever my wife takes in the tablets, she consequently feels typical pain in the lower abdomen. She is 7 months pregnant. She takes folic acid and ferrous sulfate. Lastly, which tablets amongst them are critically important, and which can she do without?
Right. The question is, what are the common tablets that are used in pregnancy?
Yeah.
These are known as supplements, and the ones he has mentioned are what every woman should be getting: folic acid and ferrous sulfate. All right. If you went to a government institution, they will also add some calcium there. So patients that go to government clinics and hospitals will be taking 3 types of tablets: the calcium, the folic acid, and the ferrous sulfate. In the private sector, people are more likely to be taking 1 tablet that contains all of those. These are supplements. The ones that we give in the private sector would contain a lot of other minerals, such as zinc, such as magnesium, such as, vitamin B, vitamin A, and so on and so forth. All these things will be there together with the iron and together with the folic acid and the calcium. These are supplements. Which ones are recommended? Strictly speaking, you should be taking iron and folic acid. Okay, nowadays there is the omegas that are recommended as well, and these are found in most of these tablets that are given in the private sector. They say the omega-3 seems to play a role in the development of the brain, seems to improve intelligence or a cognitive function of the unborn baby's brain. The folic acid, on the other hand, is meant largely to prevent neural tube defects. And because this is so, we would ideally expect everyone who is planning to fall pregnant to take folic acid prior to pregnancy. Because if you did that, then you get the maximum benefit. That the neural tube defects would occur during organogenesis, during the formation of the organs. So it is better that you take these things prior to falling pregnant, because organs start to form between the 6th week and the process is completed by the 12th week of pregnancy. So if you start them already when you're pregnant, you will have missed the bus. But in addition, it prevents megaloblastic anemia. So, and it is needed for the fast-growing tissues, for fast-growing cells. And a baby is one such organism where the organs are growing every day. So you need folic acid for that purpose. Iron, on the other hand, is for the formation of the heme that is needed for carrying oxygen, and the hemoglobin is the one that does that function. So if you take iron, you are now increasing your hemoglobin, and your oxygen carrying capacity is also increased. You know that a baby is actually a parasite. A baby is a very efficient parasite that is going to extract as much iron from the mother as possible, and therefore there needs to be replenishment of the iron stores in the form of iron that we give to these mothers. Therefore, everyone who is pregnant needs to be taking iron so that they do not get depleted iron. And this also helps to safeguard these women against blood loss that is going to happen at the time of birth. Every woman who's pregnant is going to bleed. Whether you have a cesarean section or you have a normal delivery, you must lose blood. But if you have been taking these preparations, they then increase or improve your iron stores. Therefore, even if you lose blood, you're not likely to bleed to a point where it will be symptomatic.
So the advice is she needs to continue with the medication.
She needs to continue. Well, the discomfort that he is talking about could be a result of the iron. When iron it gets into the abdomen, there is some degree of cramping, especially if you were to take it on an empty stomach. Incidentally, it is actually preferred that you take it on an empty stomach, because when you have an empty stomach, the acid is not diluted. You need the acid in the stomach for absorption to take place. But because if you took it on an empty stomach, the side effects are worse, then there is a compromise that take it with meals. It will reduce the absorption somewhat, but at least some of it will get into the system and there will be less side effects. So if she was to take it on an empty stomach, she'll realize that the side effects are actually bad.
All right, here's a reminder of the numbers to use to get in touch with us. If you would like to send a WhatsApp text message, the number is 079-295-1212, 079-295-1212. The voice note line is 0607715107, 0607715107. Good evening, Rebecca and Doctor. How long after giving birth should we resume with intercourse? My partner is impatient and my baby is 5 months old now.
5 months old? That's too long. That is very long. Okay. In general, we expect pregnancy changes to have normalized by the 6th week. 6 weeks. That this 6-week checkup is very critical. If you are pregnant or once you give birth to a baby, when we discharge you, we always give you your checkup at 6 weeks. At 6 weeks, that's when we're going to examine and verify that things have gone back to normal. That is the time we're going to talk to you about contraception. And that is the time we can now talk about intimacy issues. Now, 5 months is very unreasonable. If you are depriving him of his conjugal rights, in fact, he is not being impatient. He is just being normal. All right? 6 months is too long. It's also unreasonable. In the olden days, they used to say 3 months. But this 3 months was because there was no contraception. And our people realized that if a woman gives birth to a baby and she takes 3 months before she starts with intercourse, should she fall pregnant after 3 months, that baby will be born the following year. And that will not be such a bad idea. But it is sometimes possible that if you don't use contraception, you can actually deliver babies in the same year. You can have a baby in January and have a baby by December. And we have had patients like that. So the 3 months was for that purpose. But nowadays, there is no need for you to observe 3 months because you can easily avoid pregnancy by using contraception. All right? So, and remember, Rebecca, that she's telling us that the baby is 5 months old. But they may actually have stopped with intercourse way before that baby was born because it became uncomfortable and therefore they stopped. So you can add those months to the 5 months that we're talking about. It can easily be a year already
So the partner
of them not having intercourse.
Yeah.
Yes.
Okay. Good evening, Rebecca and Doctor. On the 14th of March, I had my normal menstrual cycle. And then on the 7th of April, I started bleeding heavily with clots. I don't know what is the problem. Help, Doctor.
Right. Like we have been saying on numerous occasions, when this sort of thing happens, we must exclude pregnancy. And in this instance, we worry about abnormal pregnancy states, such as a miscarriage, such as an ectopic pregnancy. All right? In the absence of those, it is very clear, therefore, that there could be abnormal ovarian function. Okay? But if this is a once-off kind of thing, it might not be such a bad thing if the problem is the ovary. However, we don't know how old she is. We cannot rule out the possibility of the presence of fibroids there. So she would also need to be examined. But pregnancy has to be excluded in any woman who's in the reproductive age and having an alteration in the normal functioning of a cycle.
Good evening, Doctor. I had a BTL sterilization. Is it possible for me to give birth again? Can I go to a gynecologist to open for birth? I'm 38 years old.
Right. This is the question we have tackled on numerous occasions. Women who have sterilized and now they have a desire to want to have a baby. Right. The answer is yes, it's possible. But it will depend on, one, what kind of sterilization she had. All right. 2, how much of the tube, if the tube was cut, how much of it has been removed. And 3, who is the person who's going to do the operation to reverse the sterilization. Okay. In general, where the tube is cut and tied, the likelihood of reversal is not so good. Whereas if the tube was clamped, what we call laparoscopic sterilization, that one, the whole tube is still there. So what we do, we just go on the area which was clamped, we remove the clamp, and then we rejoin the tubes. The chances of success would be much better there. She's 38 years. We know that as you get older, the ovary itself starts to have poor functioning. All right? Just like I always give an example of saying, you know, our sports people, particularly athletes, when you are young, you can easily run a marathon and win and get medals. The same person, when they get older, it becomes less and less likely for them to run and win a marathon because their bodies are now older. And I always gave an example about with Bruce Fordyce, who is still running the Comrades Marathon today. And Bruce Fordyce, if I'm not mistaken, holds the record of having won both the up and the down runs. But now he's older. There are younger people who run faster. And our bodies are actually like that. So the ovary, as you get older, is less efficient. So you can have reversal of the procedure and still not fall pregnant. The best advice we give to women who have sterilized and they wish to have another child is to undergo in vitro fertilization, wherein you don't have to have any operation done. As long as you've got an ovary and you've got a womb and a man with normal sperm, they will go and mix this in the laboratory and transfer them back into the womb, and you will have your baby.
All right, we are in conversation with Dr. Maluleke. He is our resident gynecologist. We're taking all of your gynecology-related questions. Send them through to our WhatsApp text line 079-295-1212, 079-295-1212, or send us a voice note to 060-7715-107, 060-7715-107, or give us a call as we continue answering all of your questions after the break.
Conversations with Rebecca Pala. Have your say. Call us now on 015-151-1058.
Your attention, please.
Hello there, can you hear me?
Please stand by.
The fact that you're hearing this voice means that local radio advertising works. Use the power of Energy FM to reach thousands of potential customers in Polokwane, Seshego, Tzani, Liboahomo, Mangwe, Mukopane, and other areas within our broadcast footprint. Increase brand awareness and improve your sales with our variety of low-cost monthly packages designed for small and medium businesses. It's cheaper than you think. Our aim is to help your business to grow. Contact Energy FM Sales now on 015-151-0039, 015-151-0039, or email sales. This limited offer is only available to local SMEs.
Telefona leki jaija yo.
Loko hi tivumba nyanza yin'we hi nga endla swilo leswinene se ke a hi tivumbeni nyanza yin'we kutani kuma nsawutiso wu ponisa
Mapalashi wa stressa wa mfonela mona ke khani something is wrong. Kure na ukule babala ditaba tsa 8 ar khani kita na yena. Ali balele nako ni.
Yeah.
Ya phone na utshayishije ola.
O santse wa le tseleng. Yeah.
I even answered her phone, when you're talking, we are on air.
Yeah.
Can't you know? Ditaba di sentse kwa state broadcaster ba nagana hore
with an 8-megapixel camera for only $799 or the Samsung A3 Core at just $1,299.
Let's fly back there.
Or get the SanDisk 32GB Glide USB 3.0 only $129. Go big with Cell C this winter and scratch to win. Life's better when you can.
Conversations with Rebecca Pala. Have your say. Call us now on 015-151-1058.
015-151-1058. That is the number to dial if you would like to join in the conversation through a call and ask your question. This is still Conversations on Energy FM and Choice FM. I'm in conversation with our resident gynecologist, Dr. Maluleke. We are taking all of your gynecology related questions. This is how you can get in touch with us. If you would like to also send a message, the WhatsApp text line is 079 295 1212, 079 295 1212. If you would like to send a voice note, the voice note line is 060 7715 107, 060 7715 107. Going back to the WhatsApp text line. Good evening, doctor. I'm 30 years old. I'm a woman and I have a 7-year-old child. I would like to have another child, but I worry that I may face complications due to years. Another thing is my menstruation. I bleed heavily on the first day and the second day. It's almost as though there's nothing. Is it normal or do I need to see a doctor?
Rebecca, the first question I would like to ask is, why did she take so long? 7 years. I must say, nowadays my thinking has changed about this whole thing of spacing of the children.
Okay.
You know, I keep on telling people that the concept of conception was brought to us by the white people, right? We had our own way of doing it. This is why in the olden days you would have 12, 15 children born by from a single person. Nowadays we're saying we're spacing our children, right? And we have reduced the number of children we are giving birth to. Now I'm saying our people are the ones who are observing this so-called spacing. The white people are not. They have a child every year and they are done. Okay? They'll have a child this year and a child next year and the child the other year. And they're finished. Because everything needs to have its own time. You can't always be having a child, you know. You take 7 years and then you have another child, another 7 years, then you will realize you spend most of your years having a child in your life. And that may be slowing us down as a people. Now, she is now, did she say 38?
30.
30 years. Okay. So it means when she had her first child, she was 23 years. Okay. At 30 years, I don't think there's a problem as such. She can have a child. However, the fact that she's having an abnormal menstruation suggests that there could be other problems that need to be excluded, such as the presence of fibroids. The kind of problem she has described here would sometimes fit in with the presence of uterine fibroids. Not so common at her age, but we start seeing younger and younger women developing fibroids as well, especially if you take long with the issue of reproduction. There is a bumper sticker that I saw some years ago, which went something like, good girls get fibroids and bad girls get babies. For some reason, Rebecca, those women who fall pregnant don't develop fibroids. Those who postpone pregnancy tend to develop fibroids. It's something that people need to think about.
And the listener has actually sent in a message again to say they are not using any contraceptives, and this is dating back to 2014.
Absolutely. There is, by definition, she falls in the category of secondary infertility. Because we say if a couple that is not using any contraception has regular intercourse, and by that we mean not less than 3 times per week, if after 12 months of that kind of activity there is no baby, there is a problem of infertility there. Right. And this could either be the man, who accounts for 40% of instances. It could be the woman, who also accounts for the next 40%. And the remaining 20%, it could be both. Now, it is therefore necessary for the couple to go and be examined to exclude this problem or to go and find out the reason why they're not able to conceive.
Okay. Good evening, doctor. I left my pills in February and I had my period once after that. Since then, I haven't had my period to date. Could I be pregnant?
Absolutely. It's a no-brainer. You stop using contraception, you miss your period, pregnancy is on the cards. Absolutely.
Okay.
Yeah.
Good evening, Rebecca and Doctor. I just want to appreciate your program. It's an eye-opener. I'm 49 years old now. I was operated last year in June for the total removal of ovaries. Everything that the doctor mentioned, the side effects I'm experiencing, and I'm on treatment, and I also am on hormonal replacement. But one concern is, post-op, I developed this funny fat on my knees that makes me uncomfortable. Could this be something to worry about?
Fat on the knees, well, it could actually be part of the redistribution of the fat in a body, like we had said.
Yeah.
Although she's on hormone replacement therapy. When she's on hormone replacement therapy, these are meant to do what the ovary was doing. So it could be unlikely that the fat there is a result of the menopause. Therefore, she would need to go and see an orthopedic surgeon to go and find out what are other possible reasons why she's got that kind of fat there.
All right. Doctor, my partner and I have been trying for almost 2 years to start a family with no luck. We need help. What kind of medication can we use to have a family?
They can't take medication without knowing what they are treating. All right? They need to be examined first. Sometimes, Rebecca, we have what we call a trial of ovulation induction. But in actual fact, that is cutting corners. When you give someone this, you are assuming that the tubes are normal. You are assuming that the man is normal. And therefore, you give a medication to stimulate ovulation. In some instances, it works. But, it's like someone wanting to go to university without having written matric.
Okay. Good evening, big sister and my doctor. I have a problem with I had a problem with 3 different pregnancies. My first was my baby, who was born normally, but after the first one and 8 months, oh God. Okay, I'm going to have to come back to this just to rephrase it so that we read it with ease. Let's go to other questions. Good evening, Becca and Doctor. How long exactly should a woman wait before she starts having intercourse with her husband after a baby? And again, if I inserted the loop when having intercourse with my husband, is it possible that he may feel it?
How long? We had said in general 6 weeks, all right? Because the changes of pregnancy will have settled. But there are people who start earlier, okay? So as long as you are comfortable, all right? As soon as you are comfortable, you can start. There is no danger of starting earlier. But 6 weeks is the cutoff, or the time at which everybody will advise. This is true even for surgery. If you have been operated, anyway, we would always talk about the 6 weeks cutoff as the time at which certain activities can be resumed. Right. Yes, sometimes if the intrauterine device is inserted such that the strings are not cut properly, the man can feel it. Sometimes it actually comes out, or part of that string or of the device itself would be at the cervix instead of it being in the cavity. We see this every now and then. It might actually cause the discomfort on the male because he can feel it.
Okay.
Yes.
Let's go back to that question. I had a problem with 3 different pregnancies. First, my baby was born normally, but after 1 year and 8 months, there was death. Secondly, I got a miscarriage after 6 months of the pregnancy. And then again, I got an ectopic pregnancy. Help me, doctor. What is the cause? I'm 34 years old.
Well, we can only speculate. She had a normal delivery, then had a miscarriage, then an ectopic. But a miscarriage, there are many possible causes. Sometimes, believe it or not, we do all sorts of tests and still not find the cause. All right. This is also true for a baby dying just mysteriously. When a woman is attending antenatal clinic and she comes and we can't find the heartbeat and everything has been normal, we can't find the reason why this has happened. But just to give the listeners a bit of guidance. In the majority of instances, those pregnancies that are lost in the first 3 months of pregnancy, these are the ones that may be having chromosomal abnormalities or abnormalities that are not compatible with life. All right, such pregnancies are lost. The majority of those will be lost in the first 3 months of pregnancy, such that babies that are born with abnormalities are a tiny percentage of all babies that were conceived that way. Nature has a way of getting rid of such babies in the first 3 months of pregnancy. One might say losing a baby around that time could be a disguise, or a blessing in disguise rather, because had you not lost the baby, you would have a baby who is born with very severe abnormalities. That is one possible reason. The other possible reason would be infections. Any feverish infection or any feverish condition, an infection causing fever, may lead to you losing the pregnancy. The problem of uncontrolled sugar diabetes, it may sometimes lead to you losing the baby. The presence of certain infections such as syphilis, such as cytomegalovirus, certain viruses, you can lose babies as early as that time. The cervical incompetence that we talked about happens a bit later, in the mid-trimester. Like someone who said, I lost the baby at 6 months. These are the ones who will lose the baby when that conceptus is now heavy and the cervix is not able to retain it. So they lose the pregnancy around those times. Now, sometimes the presence of fibroids, especially those that are in the cavity itself, may lead to you having recurrent miscarriages. You've got certain conditions that are known as autoimmune disorders. The lupus anticoagulant, systemic lupus, antiphospholipid syndrome, rheumatoid arthritis. All these things may lead to people losing pregnancies. These are the ones that we are most likely able to pick up when we do investigations. So there is a variety of reasons why you can have a miscarriage. As for the ectopic pregnancy, the potential cause or the common cause for an ectopic pregnancy is usually infection that affects the tubes. But this infection is not severe enough to block the tube. So instead, there is damage of the apparatus inside the tube, what we call the ciliary processes that are needed to transport a fertilized egg. Remember, fertilization happens in the tube, and it has to be transported to the uterus for it to grow. So if this tube is damaged, even though fertilization has taken place, it is not able to transport the fertilized egg. What does the egg do? Once it is fertilized, within a particular period, the egg has to implant, and it will implant wherever it is, and it may happen to be the tube itself, and then you get an ectopic pregnancy.
That is our time, Doctor. Your contact details, please.
We are in Polokwane at 72A Compensati Street, 015-295-9407 or 295-9419.
Thank you very much, Doctor. Our next appointment with you is next Thursday.
Thank you and good night.
That's all the time we had on Conversations. Coming up next on Choice FM is Stanley Brown.